Good evening, everyone present here. With the rise of the pandemic, we have realized how this profession has played a major, fundamental, and key role in helping the society to tackle this problem. The art of medicine has always centered the care and the needs of humanity and has always helped for its cause since time immemorial. Hippocrates, father of medicines, said, and I quote, wherever the art of medicine is loved, there's also a love of humanity. I take an immense pleasure that today I address you people, the pure souls who have put away their comfort, their families, and sometimes even their desires for just helping humanity. So today, I, Bhanu Pratap, along with my team, Dr. Acharya, Dr. Anmol Khadka, Zenish Niraula, and Karthik Solanki, are here with the second session of our After MBBS program for the orientation of Plab. Many of us are aware that we are going to pursue, like what we are going to pursue after MBBS. Many of us are confused. There are some of us who totally are unaware what they're going to do, what their options are. So today's seminar will guide you about such options, and one of such options is PLAB. For those of you who don't know what PLAB stands for, it stands for Professional and Linguistic Assessment Board. It's an exam you need to give in order to attain license and GMC registration. GMC as in General Medical Council, to practice medicine in the UK. UK as in United Kingdom, which consists of 3 countries, England, Scotland, Wales, and North Ireland. Like the first session, we are live here at the official YouTube page of Student Development Committee here at Nepal Medical College. We have attached a Google form in the live chat. Please drop your question in the provided link so we can answer them in the question and answer session. At the end of the presentation, also, there is a feedback form in the link. Please do fill that also after the seminar is over. Without taking much time, I would now like to introduce you to our presenter to guide through our journey to PLAB today. We have amongst us one of our seniors of 13th batch of NMCTH who gave his PLAB exam in the year of 2019 and is presently working in St. George's Hospital in London as a junior clinical fellow in neurosurgery with the National Health Service. So please welcome Dr. Ashish Basnet, also known as Kazidai.
Hi, thank you so much for warm welcome, Vanu. Good evening, everyone, whoever has joined here with me to get information about Clab today. And I would like to thank Student Development Committee for the opportunity that you guys have given me to orientate all my fellow juniors to know what Clab is basically, what to do, how can I or anyone else become a doctor here in the UK. First of all, I'll like to ask if everyone is in good health, and I hope all of your family members are in good health. And basically, this pandemic was a very disastrous moment in our life and has taught us how to deal with ourselves in loneliness, as well as how to deal some obstacles that we can face, and most importantly, has reiterated how we medical fellows are a very sorry, I'm having some technical glitches, so let me just adjust that first of all. Okay, yep. I hope that's okay. Apologies for that. I'm not too sure. I do apologize for the poor quality of the camera if you guys are not able to quite see me, because I just got free and I've just written back from work and I'm presenting it from a mobile, so I'm not so sure whether the quality would be up to the mark, but still I'll try my level best to give you all the information that I can and try to answer as much as your queries that you have, but at the same time is limited, so I would request all my organizers to, if there are repeated questions being asked and to merge it as a single one and then ask me, and I'll be more than happy to help you in each and every possible way. And at the same time, if you guys, after this program, if you want any kind of help, if you are not satisfied with this presentation, I'm more than happy to be contacted at any times. I will leave the link of my contact below as well, and then you can contact me via WhatsApp, or you can email me, or you can contact me via Facebook, any kind of social media. I'm more than happy to help you guys. So just a moment, and let me see if you guys can see this or not. Give me a thumbs up if you guys are seeing this. Banu, Janice, anyone? Is it okay?
Yes, that it's working. It's present.
Okay. So yeah, so let's move on to our today's seminar itself. So pathways to become a doctor in the UK. So basically, there are different routes through which you can become a doctor in the UK. The most commonest is Clab, which Vanu has already mentioned what it stands for, and there are membership examinations which include MRCS, MRCP, MRC COG, MRCEM. I would not go much into this at the moment because yes, definitely I'll answer those questions at the last, and I've included some parts of it as well in my presentation itself. And the other thing is medical training initiative, which is basically after your post-graduation, you can always apply through this route as well in order to get GMC registration. But now let's focus on PLAB. So basically PLAB has two parts, PLAB 1 and PLAB 2. So first step is to your journey towards being a doctor in the UK is you'll have to prove your English proficiency. This is where I had most of the obstacles, to be honest. I gave Ielts more than 5 times maybe. Yes, if I remember correctly, yes. So as you know, I should have paid more attention when they were more attention to my English teacher when they were giving me good lectures. But I learned that the hard way that IELTS is a very tough exam. So, but moving on, IELTS, you'll have to give an academic version of that. So basically there is general as well as academic. So in order to get registered with the GMC, we'll have to give IELTS academic version. So it basically consists of 4 modules, which is listening, reading, writing, and speaking. The scores given on this each module is from 1 to 9. So for CLAB, what you have to score, you must score is at least 7 in each module. That is 7 in listening, 7 in reading, 7 in writing, and 7 in speaking. And aggregate of those all modules should be 7.5. But trust me, if you get 7 in each modules, you will not be getting aggregate of 7.5. So you'll have to at least score 7.5 either in 2 modules or 8 in at least 1 module. Then you will get an aggregate of 7.5. But if you are looking at your IELTS report and you see 7 in each module, but aggregate it's 7, then yes, that's their fair assessment. You will have to score either 7 and above to get an aggregate of 7.5 in each one of the modules. So basically now, when I was giving IELTS, it was only paper-based. So now they have made it more advanced, and you can see in your screen that it's paper-based and it's computer-based. So prices vary accordingly as well. If it's paper-based, then you'll have to pay around 23,000 Nepalese rupees. And if you give computer-based, then it's 21,500. So exam venues and dates can be looked in the official website itself. And in Nepal, if you're speaking specifically, then we have British Council and IDP. These both centers conduct IELTS exam independently, and both of them are valid in order to get registered with the GMC or for your CLAB exam itself. So now there is some questions about what should I give, either IELTS or OET. So OET from from A to E. So basically, you'll be graded A, B, C, D, E. So in order to be eligible to apply for Clab, you'll have to score minimum of grade B in each module and overall B in a single setting, which means like you can see if you have your friend who is a nurse, or if you hear a nurse giving exams, like what they say is that, oh, we can clear OET in basically in two settings. That is, they also need B, but they can always attempt, they can always attempt the module which they feel is very hard, like separately, and their overall would be still accounted, and they can apply for the respective country's registration. But for us medicos, we cannot do that. We'll have to get B in each and every module, and that also in a single setting. So for this, test venues that conduct the OET exam is Universal Language and Computers Institute. It is in Baghbazar in Kathmandu, and lately they have started that Chitwan Medical College as well. So here the prices are put in here in Australian dollar, because this is basically conducted via this whole Australian system. So it totally varies upon the rate that is given on a particular day. So you don't have a specific price for OET examination. Now there are questions I do get asked whether it's go for IELTS or occupational English test. My honest suggestion would be, if your English is very good and you're very confident with your English, I would definitely ask you to go for Ielts Academic. It is cheap. You can book it very easily. Results are back within 2 weeks, and basically it's not only about medicine. You can be asked about anything at all. It's basically you'll be asked about anything: medicine, arts, culture, history, anything at all. And the materials are available, like you can just with a touch of a button you can get everything that you want in terms of. With OET it's same, because the materials, we don't find quite much materials on. The state depends upon you. If you are not confident, then I would really suggest to join an institute at all. Like there are lots of institutes now who are conducting OET. For IELTS, there are unfortunately we don't have any good institute. Even though they say that they're best, they give everything. Like we would make sure that you'll get 7 in each band. Basically, I didn't find that. That's my experience with IELTS. But yes, so comparatively OET is quite easier if I'm coming from a very less English speaking guy, but I found OET very easy, and then I cleared it in a single attempt itself, and after that the whole journey began to the UK. So I hope that answers to all those people who are asking whether go for IELTS or OET. So the second step is, after you have cleared after you have proven that I am good enough to appear for Clab exam, I have proven my English proficiency, I can speak English well, then you create a GMC account, because without GMC account you cannot book your Clab exam at all. This is free. You just have to log in. It's just basically making an account, like a Facebook account, like a Google account, Gmail account, any account. Then only you can book Clab 1 exam. So now venue for those is like we have our neighboring country, India, Pakistan, Bangladesh, Dubai, UK. There are other African countries as well who have been conducting Clab exams. But at the same time, for us, if you speak benefits in terms of travel, in terms of food, then India is the best place for us. I gave personally, me and my friends gave exam in Delhi, but some of my friends went to Pakistan, some went to Dubai, some came to UK itself to give Clab exam. But the location would be only shown once the dates are available, which can be found when you have a GMC account, and you can log in into your GMC account, and then you can always find out where the vacancy is, like in terms of the dates available. But recently, due to COVID, they've been canceling dates. Like they're not giving exact date and time. So they have been altering dates. They have been canceling respective countries examination because of COVID and all, quoting health issues and other things. But yeah, but this is the basic stuff. If you want further updates in terms of Clab exams, I would really suggest you, if you're really interested coming here in the UK, to follow the General Medical Council page. You can follow them on Twitter, Instagram, Facebook, anywhere. But Facebook has been quite reliable. They give good updates. So now coming to the Clab itself. So let's speak about part one. So usually the prep time is 2 to 3 months. I've seen people give Clab exams with 1.5 months of preparations as well. But if you talk on an average, it's 2 to 3 months. So coming to materials, these are all the things which I studied basically, and I've advised most of the people to do the same. And fortunately, they have cleared their Clab one on first attempt itself. So Khalid 1700 question, it's easily available. You can find it on Google, you can find it on Drive. There are no password associated with any of this. You can download it and you don't have to pay any price at all. But when you come to Clabable, you'll need to subscribe this, because this is an online platform. So if you want to get access to this, then you'll have to pay around 30 quid. But this is the crucial thing. If you are preparing for Clab 1 exam, you need to know Clabable. You need to know it. If you know Clabable, if you finished it once, twice, along with Khalid's 1700 questions, then I think you're good to go. You will clear Clab in your first attempt itself. So, but recently, as well as I mentioned, lots of banks have come, and Clab 1 Keys is one. I Aspire, I think there are few others available, but the most reliable one is Clabable. So go for it if you are preparing for part one. The price is £240. As I said previously, for the OET itself, it totally depends upon the rate itself, like what's the rate for the actual date itself. So, but yeah, prepare your mind for that. Oh, it costs around £240, and they increased it recently as well. So, yeah, so previously, in terms of at what time of the year was it held, it was mainly in March, June, September, and November, with June and September predominantly being within the UK, and March and November being outside the UK. But now, recently, they have changed everything, and I've known people who have given their exams in Dubai in March, in June, September, November. So Dubai is being a really good spot for GMC to organize exams. I've seen like a lot of people go to Dubai, especially from Nepal and India, to give their Clab exams, and even from African countries as well. Most of the people have gone to Dubai to give the exams. So look after the dates. So how hard is Clab 1? This is a good question. I hope this chart published by the General Medical Council itself would answer that question. So this is the recent 2020 data that I've collected here. The number of Clab 1 candidates who sat Clab 1 were 10,601, and among them, so the number of candidates who passed were 7,384. So almost 70%, isn't it? So that's not bad, I guess. Recently, so if you look at the trend, yes, obviously, but you can see the number as well, which is increasing exponentially. And basically, these are the tables that you might get in IELTS, and you'll have to explain what do you see in the tables as well. I'm just giving you guys like a demo of what can you expect in IELTS writing as well. So basically, they'll give tables like this, and you'll have to explain. So now, after you've finished your English proficiency test, booked a Clab 1, gave your Clab 1 exam, passed it. Now, what to do next? You need to book your Clab 2 exam immediately. Because here, like the Clab 1 results are announced at 9 o'clock GMT, that's the UK time, but in India, in Nepal, it comes to be around at 2 or 3 o'clock, and most of we don't have access to credit cards or debit cards. And in that case, what you'll have to go to a bank to book your Clab 2 exams. So if you have someone to do, then yes, I would suggest you go and ask your friend, your family members to book the Clab 2 exams immediately. If not, you can always wait the next day, look for dates. So make your mind up, like these are the dates that I'll book Clab 2 exams, because you'll have to prepare your visa documentation, do other paperwork as well. Uh, so yes, book Clab 2 exam now, and then prepare the visa documentation. There are a bunch of visa documentation that you need to prepare, and it totally depends upon like where you are applying from, and it varies from individual person. So like it totally depends. I have posted a few documents which are needed on my Facebook group, Clab Help Nepal. So you all can go there and see basics of Clab pathway. I've explained in detail what are the documents that are needed for visa application, and then do epic verification. So previously, when my friends applied, they did not have to do any of those things. But now recently, they want everyone to have an epic verification. Sorry about the spelling mistake over there. So this basically nothing. They just are asking you to verify your undergraduate degree. You know, when you get qualified and you get your medical degree when you attend your convocation, which everyone, the interns are specifically waiting for, I guess. So yeah, they just want to verify that your document is legit. That's it. But then again, dollars. So yeah, in a sense, you might feel like, oh, they're taking, how much should I pay? How many times should I pay all the money? And it's quite embarrassing asking your friend as well, isn't it? Or sorry, not friend, you're probably friend as well, but mostly your family members, your parents, because they feel like now you've completed you have finished a medical degree, you're studying. But yes, this is what it is. In order to get to the UK, I wish I could change that, but unfortunately I cannot. So yeah, so what to do if I do not get Clab to date? So this is another common question which is arising recently. So yes, basically don't worry about a thing. Every little thing is going to be all right. So yeah, this is a very good song of Bob Marley. You just listen to this song, because there are other things that you can do if you do not get Clab to date. So things like membership exam dates, and this is very, very crucial. This is why I'm saying this, is because I wished they had given these exams when I was back home, because I had plenty of time to prepare for these exams. But I just focused on Clab, and I'm going. I've got my visa. I'm applying for visa. I'm preparing for Clab 2. Yes, don't worry. You can prepare for Clab 2 after you have given these exams, or whenever you get visa and whenever you finalize your academy and things like that. But you need to always be vigilant about things that you want to do when you come to the UK. And for that case, doing a membership exam is very, very, very important. If you have this membership exams cleared, you will not struggle to find a job, and I can guarantee you that. So this is very, very important. And the reason why I'm saying is for you to have it done when you're back home is, here you cannot have gaps. Basically, you are expected to clear your eggs while you're working, and most of the people do it here. Okay, so it's not a big thing. This is like a very simple thing. So where can you go and book these exam dates? So basically, it's conducted in Nepal as well by British Council, in India, in Bangladesh, in Malaysia. So yes, it's basically like Clab itself. So you can always give these exams. I'll come later on. I think there will be some specific questions about this as well. I will go into detail in Q&A about these things. And the benefit now, why I'm saying is to give membership exam, is that you do not have to go to an examination center to give these exams. You can do these exams sitting at your home, relaxing, drinking a cup of coffee, not beer. But yeah, if you want, you can do that as well. And if you want further information, you can always go to your respective Royal College's website, like Royal College of Surgeon, Royal College of Physician, Royal College of Obstetric and Gynecology, Royal College of Emergency Medicine, Royal College of General Practice. They have basically Royal Colleges for everything here. So now, okay, let's move. After that, let's move on to PLAB 2. Now, you've got a date. You come to the UK after applying for visa. You are happy that you've landed here in the UK. Now you're worried about what to do now. PLAB 2. What is PLAB 2? So basically, it's an OSCE exam. Like, you know how your short case are done in your final year medicine examination. Hopefully, I did not remind much of the torture that you had faced. I'm sorry, I do apologize for that. But yes, it's basically an OSCE exam where you have 18 stations. So you must clear at least 11 station and score must be above average pass mark for that particular day. So what this means is, in total, you will be having 20 people for that particular session giving PLAB 2 exams. So the pass mark would be, so the pass mark usually is a grand total average of all those people who are giving the exam that particular day. Meaning is, if I get like 8 out of 12 in a station, but my colleague gets 4 out of 12 in a station, so they will add those both and then create an average. I don't know exactly how it's done. It's the GMC does that, but this is how it works. There is no specific average pass, like a specific cutoff point, which clarifies that you are pass or fail. It will be decided on that same day. And it's the same for the PLAB as well. Basically, in the UK, it's the same for every exams. There is no cutoff point for any exams. It can be 67, it can be 72% as well for PLAB 1, or it can be even 63%. So it's for the PLAB 2 as well, it's the same. So venue, it's in Manchester. It's the only place where PLAB 2 is conducted. Previously, when I was giving, they used to give, they had a center in London as well, and now they have completely scraped it off and they are only conducting it in Manchester. I've got some information that they're trying to increase. That's from the GMC website itself and from the Facebook page, and we do get emails as well sometimes. From once you're registered with the GMC, they send a bunch of emails like that they are trying to increase the numbers, but you never know. So until and unless it's announced, don't think that there are multiple centers. There's only one center in GMC building in Manchester, UK. So the price is £875. You will have to pay it in advance, like I advised before. So now, how will you be graded? So each domain in PLAB 2 contains, there are basically 3 domains. One is data gathering, technical and assessment skill. This basically includes your history taking, your clinical examination skills, how you do practical procedures like putting a cannula in, putting a catheter in, doing an arterial blood gas. You would not be asked to put a suture or other things like that, but yes. So basically, you need to do things. There are things that you need to do in order to come to a diagnosis. Basically, they will look at this. So this constitutes of 4 marks, and the clinical management skills. So once you have diagnosed what the problem is, like you have diagnosed a patient with a COPD. Now, what do you manage? So now, what do you do? So yes. So this is like they'll ask you questions. So how do you manage this case? So yes. So you basically have to spill it out, everything to the examiner, or explain it to the patient that how you're managing him, how you're managing her, or how you're managing, if it's in a child, then how are you managing both the parents as well as the child, because parents will have a lot of expectation and they'll have a lot of questions. So yes, so they'll look at those things as well. And this interpersonal skills, so this is the skills in which you will have to show how good you are when it comes to speaking with your patients. So here in the UK, it's basically patient-oriented management. So you will have to listen to your patient and you'll have to, well, what is the thing that's bothering him? So you will get into it once you join an academy or once you get into details about knowing, like in depth, knowledge about the Clab, but yes, basically interpersonal skill is how you communicate, how you show your empathy. So yes, these are basically looked when they are grading you in terms of interpersonal skills. So yes, I think I mentioned each consists of 4 marks. So yes, the pass rate for Clab 2. So you can see the number, the even Clab. So yes, so in 2020 it was 3,654 with a pass percentage. Good, I think. Recently, more people have started giving it. So yes, always the pass percentage will definitely vary. But yes, if you know what you're doing and if you give a patient-oriented treatment, then I think you can clear Clab 2 in a single attempt itself. Sorry. So yeah, now you've given your Clab 2 exams. Now what to do after Clab 2 exams? So what you need to do is after you've finished your Clab 2 exams, you'll get a notification. It doesn't matter. Again, marks does not matter. It's pass or fail. It does not matter. I passed all 18 stations and I only passed 11 stations. Does not matter at all. You pass that 11, the guy or the girl who passed 18 stations can also apply for Gnc registration. The one who passed only 11 stations but has a past result in hand can also apply for Gnc registration and also can apply for the same job. You will not be graded at all by looking at your Clab 2 exams. So apply for Gnc registration. So this is something which you need to know before you come to the UK as well, because there are some people who would like to apply for Gnc registration while they are in the UK itself. So what you can do is you can prepare everything before you come to the UK. That's EPIC verification, which I've already talked about, passport, which you'll always have if you're traveling, good standing certificate from respective medical council. So by this I mean for Nepalese medicos, what you can do is go to Nepal Medical Council and they'll give you a good standing certificate, internship completion certificate, which will be provided by your respective colleges, IELTS and OET results, which if you have given IELTS, then they will give it to you. OET, you can either share it directly with GMC or you can even download and upload it. And the license registration means once you've given your licensing exams, you'll be given either temporary registration, and after 2 years of temporary registration, permanent registration. So again, you'll have to pay 157 pound to apply for Gnc registration. Yeah, I know, money, isn't it? Like, how many times should I have to pay? I felt the same like asking money from my parents again and again. So after Gnc registration, what to do? Apply for jobs. So this is another question which is heating up in the international market who are applying for Clab. So the thing is, will I get a job? Yes, you will get a job. There's abundance of job right now in the UK. The thing is, they are certainly looking for some people who qualify, who are sometimes overqualified for the jobs as well. And you can see you are competing not only with your fellow colleagues who are applying for that jobs, you are competing with all other international medical graduates. So you'll have to either be good or either you'll have to have some extra things when you compare them with the other international medical graduate as well. So yes, this is why I was telling, if you're having a big long gap when you're appearing for Clab 2 exams, even giving just a single part of MRCP or MRCS or MRCOG would be really helpful in terms of getting jobs. So basically, if you're looking for NHS jobs, National Health Service, which is basically a government job, here health service is completely run by the government. So what you can do is you can apply jobs through jobs.nhs.uk. Basically, they have changed their website now. So jobs.nhs.uk does not mean that you cannot apply. You'll only have to apply in England. There's a separate website for Scotland. So you can always apply jobs in Scotland as well. So you just need to look for it. And that is this track jobs, because some of the jobs, these two are quite linked with each other, but some of the jobs which are not seen in NHS jobs can be found on track jobs. But the jobs that you find in NHS jobs will be definitely found in track jobs. So yes, you can go to this and then you can look for NHS jobs. Now, the other questions, UKMLA. I think most of the juniors who are yet to give their final year exams, or even those people who are in the second year or third year medical school at the moment, they have a big questions about UKMLA. Everyone has the same questions, trust me. All other people also are keen to know about UKMLA, but there's not much information, I'm afraid. So this will the pilot project has started here in the UK. The thing is that they have also asked the UK graduates to appear for these exams, but for the international medical graduate, I've put on the link down here. You can always go to this link and find out further information. But just briefly, it's basically going to start from 2024. There's nothing extra or nothing has been changed from your Clab exam. They have just changed the name, basically for their part 1 and part 2 exams. But you'll have to prove your English proficiency. So part 1 would be Applied Knowledge Test, which is AKT. Basically, this is just like Clab 1 exams. The only downside to it is you will not know what kind of questions they might ask. They might include some membership questions, like questions as well, to filter out. There are always some hard questions to filter out those to get to a passing mark, I guess. Yeah. But the questions, what they have written in the website is the questions will be similar to the Clab 1 exams itself. And then the OSCE Clab 2, they have named Clinical and Professional Skill Assessment, CPSA, which is basically similar to Clab 2. They might add few scenarios, but we exactly don't know what they're going to do with this. So we'll just have to wait for the time being. So yes, basically this is the brief information that can be found about UKMLA for international medical graduates. So I hope this answers a few of my juniors' questions in terms of UKMLA. But up until that point, Clab. Up until 2023, you can give Clab. So now there's another big question: NHS versus private, which is better? This is a question which I often get asked. As we are struggling to get jobs, private sector does offer you a job very quickly. That's true. But at the same time, you will have to have decent experience. They will look for a medical officer level job. So medical officer level job, you will have to have at least 12 months of experience. So they will look for that as well, because you'll not be applying alone. There are other international graduates as well which will be looking for the same thing. So yes, it is easier in comparison to NHS jobs. And what you can do, you just need to give your CV and they will look the jobs for you. But in NHS, you'll have to go through every specialty, like whatever you are interested in: surgery, medicine, orthopedics, trauma and orthopedics, gynecology, pediatrics, ENT. So yes, you'll just have to keep on looking each and every day, apply for jobs. Basically, after Gnc registration, you'll just have to sit in the computer and then apply for jobs. So pay is according to F2, which is basically F2 meaning foundation year 2, F2 level, which we are given. It's like after you finish your intensive, you're called F2. The next year is called F2 here in the UK. So intensive is called foundation year 1. After that period, it's called foundation year 2. So the pay totally depends upon which grade you are hired at. So it's F2, then you'll have a slightly less pay, but manageable. You can manage. You can literally live a lavish life if you want to. JCFE Junior Clinical Fellow, which I am doing at the moment, which is basically a senior house officer post. If you want to know which level, it's equivalent to ST1, ST2, which is just prior to the registrar level. So another is core training. Core training also is like CT1, CT2. There's basically no difference. It's basically same as ST1 and ST2. This is also pre-registrar level jobs. And you might ask, trust grade doctor. So this is basically, it's basically trust grade doctor is called a non-training. So basically they can be of any level, F2, JCF, core, any level at all. So if you go for NHS jobs, you'll have to come regularly, even in the weekends, like me at the moment. So yes, regular day jobs. It'll be 8 to 5. You'll have to do long days. You'll have to do short days. You'll have to do nights. But in private sector, what happens is you'll have to work for 1 week, and you get 1 week off. This is basically how it's working at the moment. I don't know if there's other different, because I've not come across any of the people who have said that, oh, I'm working continuously 2 weeks. 2 weeks. You can do that as well. It totally depends upon you if you're planning a vacation or anything and such like that. But yes, but basically the working hours are quite flexible. But you'll have to be so you'll have to be in the hospital for a total of complete week. For a total of 1 week, and the next week you'll get off. Pay would totally depend upon your skills and experience, as I mentioned previously. But the private jobs can be both NHS as well as in a private hospital itself. So yes, they can say, so you'll have to work in an NHS hospital, or this is a private hospital. So in private hospital, what my friends have told me is that usually they are the one who look after almost all the patients. But here, if from a private sector itself, if you go to NHS jobs, you will have someone to look after you. Like if you're feeling like, if you're worried about some patient, then there's always someone. It's not that in the private sector you will not have. There will always be someone who you can speak with, or you can always seek advice. But yes, basically you'll be covering most of the things all by yourself. So you'll have a dedicated educational supervisor as well. The meaning of this is that there will be someone, a consultant working here in the UK, guiding you, like, okay, what are the things that you want to do. You can be a proactive member of the team if you're working in a private hospital, and then you can seek that as well. It's not that you cannot do while you're working private, but it totally depends upon you, whether you want to go, what you want to do, and speak with your supervisor or speak with the consultant, like what are your advice on becoming a surgeon, becoming a general practitioner, becoming a physician. So yes, but the only benefit is that they will shadow you, and then you will have better knowledge of the system. So even if you don't know the system, how it works, they will provide you a shadowing period, or they will give you someone to tag along so that you can know the system better. So why choose UK? So yes, flexible working hours. You will not be working more than 46 hours per week, but yes, it totally depends if you're doing locums, or if you want to earn extra money, then yes, you can always do locums. But yes, basically it's 46 hours per week. You will not be allowed to cross this mark, basically. But if you compare to the US, I think it's more than 72 hours per week. I'm not so sure. You can ask your other seniors as well. I think they will those who are doing Usmle and been working there. But yes, I know for a fact that the working out in the UK is much less than the US. More job opportunities, meaning that you can apply for jobs. You can basically start your training from ground level in here. Decent pay, yeah, not extravagantly as the Usmle pay is, but at the same time, you can have a good lifestyle, send money to your family, and do a decent amount of saving. That's all you need, isn't it? Nothing more than that. You can go for a vacation if you want to. Europe is very near. Everyone dreams of going to Europe. So yes, you can always go to anywhere you like. Obviously not now, but yes, in future you can always go wherever you like. And basically there are you'll be on a liberty if you work here in the UK, if you want to go to other European countries. So free health, yes, health is free once you are sorry about the mistake here. Free health, yes. You'll not have to pay a penny if you are registered with the NHS. You do not have to pay anything at all for any kind of major operations at all. Of course, there are some delays, but yes, you don't have to pay anything at all. Can apply for any specialty training. By that I mean you can apply for if you know if you know how to apply, what are the things that you need to apply for training here in the UK, you can get neurosurgery, cardiothoracic surgery, general surgery. One of my friends recently got into a run-on through general surgery, and he's from Nepal. He was my friend back from college. He basically came here, did all the things, ticked all the boxes. He got into a run through general surgical training post here in the UK. Now, after 8 years, yes, he will become a consultant general surgeon. And the most important thing is football. Everyone loves football. So, yes, those who are a football fan, you can go and watch a match. You can go wherever you want to in terms of watching football. I guess this is one of the most attractive things here as well. Apart from lovely castles and lovely other tourist places as well and lovely beaches. But yes, football. If you're a football fan like me, then you'll love it here. Yes, that's it. Thank you for listening, guys. And if you have any questions, I would be more than happy to answer those questions.
Thank you, Dai, for the wonderful presentation with all those pertinent points. I'm sure all of us have learned a lot from it and gained some important insight as well. I'm Gnc Registration, third year medical student from Nepal Medical College, and I'm one of the moderator today, and I'll be handling the program from here. Continue.
Hi, James. Yeah, sure, James. Yeah.
We have reached to the question and answer round.
Yeah, sure.
Where will we be asking questions to ask this Dai? So if you have any questions, any queries, any doubts to be clear, you're welcome to post your questions through the Google form. You can find the link in the YouTube live chat box. Go through the link and type your questions, and I'll address it to Dai. And also, let's make this round very fruitful and very pertinent as the session earlier was. Right? So, Dai, shall we start with the question and answer?
Yeah, sure. I guess it would have been much easier for those who are listening if they could have just typed the question rather than filling up the form. Just my thought.
Yeah, they will type the question in the form, and I'll be addressing it to you.
Yes. What's the question?
Okay, so the first question
Okay.
So the first question that we have is, how difficult is it to apply for residency in hospital in UK and PLAB? Does mark of PLAB, MRCP matter while applying for residency? And if you could please explain the process of applying for residency as well. So this is a chunk of question.
So yes. No problem. I think I will try to answer. Yes, this is and I expected this question, to be honest. Yes, in the UK, it's not residency. Here it's called training. The thing is, it does not matter whether you score 100 out of 100 or 70 out of 100 when you have cleared your PLAB exam or membership exam. These are all one of the routes to be registered with the GMC. It does not matter at all. And whether you have got a high score or whether you got a low score, pass, finish. You just need to pass those exams. So in terms of training programs, yes, you can apply for training. As I said, my friend got into a general neurosurgery training, and he studied in Bangladesh, came to Nepal, worked there, came here, and then ticked all the boxes. By ticking all the boxes, I mean is medical education here in the UK is very, very, very different. We are told in medical school when I was in NMC, I don't know whether you face the same problem or not. We were told, if you want, just study. Yes, that's a good thing. You need to study. You need to study very hard. I'm not saying. But at the same time, if you want to do like research, if you want to present something, go to a conference and present something, I think, why do you want to go to the conference? You're just third year medical student. Here, this is not the case. I did face the situation, which is why I'm telling you, if you are a third year medical student or a fourth year or even an internship and you say that I want to go and present a case in a seminar, in a conference. I want to do research. I want to do this. I want to publish a paper. I want to case report. Can you guide me? If someone laughs at you, laugh back at them. Because here, this is not the case. You will have to have research. You'll have to have audits. You'll have to have presentation. These are the things that matters when you're applying for residency here. Basically meaning training. I'm just using residency as a term so that it would be easier for you. And if you have all those things, you have a good chance of getting into residency here in the UK. And on top of that, there are courses. So basically, there are courses as well, like advanced life support. And some of you might have questions. Just give me a second, please. Sorry. Apologies for that. Yeah. So you will have to do some courses. It's basically advanced life support, advanced trauma life support. If it's being conducted in India and Sri Lanka, then you guys can go and attend that as well. If it's organized by Royal Colleges, then yeah, that is accepted here. But advanced cardiac life support, which is conducted by the American Heart Association, is not accepted. Yes, these are the other things that you'll have to do in order to get all your boxes ticked. So there is a thing. There is a specialty training website where you can go and find all the required things. So if you start preparing if you have only started your internship now, go to that link, open it, look at the specialty that you're interested in, look at all those things that you need to have in order to get into training, tick all those boxes. You will get, trust me, you will get into training at some point. But as I said, you'll have to always keep evolving and improving yourself. This is one thing. And why I'm telling you to give membership exam before coming to the UK is, after coming here, you might find some difficulty in adjusting with the workload, because with the system, because it's entirely different, you might be tired, and then you might not have enough time to study as well. And having those exams cleared is a plus point if you're applying for training. So yes, get all these exams sorted beforehand. Then it will be much more easier, and you can focus on only those boxes that you have to take. Sorry, it's specialty training. Okay, just give me a moment. I'll just look it for you. So yeah, specialty training.hee.nhs.uk. Go into this. You will find all the information, and there's no rule that you cannot apply for any. As I said, you can apply for neurosurgery, cardiothoracic surgery. Obviously, there will be competition, but yes, you can apply. And I hope that answers your questions. If it does not, ask it again.
Yes, thank you, Dai. The next question that we have is, how much does it cost to study PG from UK? What's the fee structure? I think he's asking about the whole from beginning to the end.
So in the UK, there is no fee if you want to do post-graduation. That is the training. You'll have to apply for it. You'll have to get selected. There's no price for it. You come here, work in the UK, apply for it. If you get selected, everything is funded by the government. Sorry, pardon me. You do not have to pay a single penny. They will be paying you monthly. So you cannot. So I'll say you might be thinking that, okay, I'll pay the money, do my training there, and come back home. That does not happen here in the UK. Previously it used to, yes, but now no. Previously meaning probably when we're in our school time, maybe, yeah. So yes, but currently no. There's no fee. If you get into training, you will not have to pay anything at all. You'll have to pay exam fee and registration fee, other things, but nothing. It's completely free.
Hashtag. We have another query which asks, if I had to choose between Clab and USMLE, what would you suggest and why?
So as I said, this is a bit a tricky question, to be honest, because it totally depends upon your preference, isn't it? Because I always wanted to come to the UK because I love, as I said, I love football, and yes, at some point I also wanted to do USMLE, and I was like you as well, like, oh, I want to do USMLE. Yes, I'll start preparing, and I did buy all those books as well. I don't know where they are at the moment, but yes, but I started thinking that when I started working in neurosurgery, I started thinking that, okay, this is something which I want to do, and I looked for other options as well. Like, what are the chances of me getting into neurosurgery abroad so that I can get enough training from a recognized country? And I found it that UK, if you come to UK, you can become a surgeon if you come to the UK. It's not like it is competitive, but in US it is very, very competitive, isn't it? Yeah. So if you're interested in medicine and you do not want to have, that is what I've been suggesting most of my friends and most of my other juniors as well, is that if you're interested in medicine, then I would suggest go for USMLE, because it's it's a 3 years, 4 years to finish your internal medicine training. Here it is 8 years. It's not that after 8 years you'll not become a full-fledged consultant. You'll become a full-fledged specialist with super specialization degree, with special interest itself within that 8 years, meaning that you will become a consultant respiratory physician with a special interest in sleep medicine, with a special interest in obstructive sleep apnea. It takes eight years, yes. Yes, it's a very long process if you want to do medicine or even anesthesia. It's in US, it's like 3 years you can do internal medicine. After that, you'll find jobs, you can work decently. So yes, but if you want to pursue a surgical career, I would really suggest there's a chance that you can get into training. You can get into training itself. I think there's a very good chance if you know what you're doing. I wish I had that guidance, because I knew that I had lots of ample of opportunities, like to tick all those boxes, which I'm doing now at the moment. Now I know that, oh, these are the things that are needed, because once you get into the system, you know more and more and more. Oh, these are the things that you need to do. Oh, yes, you need to get this done. Oh, you need to get this done. And this was all taught to me by the medical student that I sometimes take classes. Yes, so they were the one. Oh, I've already done this. Oh, and which year are you in? I mean, I'm currently a third year medical student, and I'm doing this. I'm presenting this. Yes. So yes, if you want surgery as an option, if you think surgery is a viable option, come here, because you can apply. They have scrapped this resident labor market thingy now, so you are competing along with the UK graduates as well. So if you tick all the boxes, you have very good chance of getting into surgery. But yes, as I said, if you want to do medicine, and if you do not want to spend a long amount of time, if you don't want to be here in the UK for a longer period of time, go for USMLE and then get into medicine there. That's my very, very honest advice.
Hastai, next we have is, would you suggest to directly join training program after FY2 or work as FY3 as non-trainee and gain experience of working with NHS?
So yes, if you have everything that is needed in order to get into specialty training while you are doing an F2, and just let me mention this as well, you can apply directly. If you have cleared Clab, you can apply directly for F2 training as well. But the thing is, you'll have to get high marks in Ielts exam. I think it's 7.5 in each module. So yes, if you if you have as I was saying, sorry, if you have everything that is needed to apply for training, you can directly apply for after training. But if you think that, oh, I might need these things, I might need an extra audit, oh, I might need to do an extra presentation, then you can move on to FY3. But at the same time, you should be wary about the things that there are some criteria in order to apply for training, which I mentioned in that specialty training in the UK platform. Go there. For internal medicine, you can work as much as you want, but for certain surgical specialty, you cannot work more than 18 months. Like for neurosurgery, you cannot work more than 12 months in either neuroradiology, neurology, or neurosurgery. So if you have crossed that limit, then you cannot apply. So these are the things that you need to be worried about. You need to think about. And if you want to do surgery, then it's 18 months, and you feel like, oh, okay, I have not ticked few boxes. But there are certain ways that you can do those things as well. But yes, as I said, if you have everything in your hand, that okay, these are the things that I believe, and once you're here, always go through the trainees that they are here. Once you've got a job, ask the trainees, do you think these things will be enough, or do I need to do anything else? And then yes, if they tell you that okay, you can do that, you can do this as well, this will give you an extra point, then yes, you can do that. But just after FY2, if you have all those things, I would say go for it. It will give you a good experience as well, and prepare you better when you apply next year.
Astai, there's another question asking, what are the type of question asked in Plab 1 and 2?
So Clab 1 is anatomy, physiology, pharmacology, basics, a little bit of basics, mostly medical scenarios. As I said, the Plabable has categorized anatomy, physiology, pharmacology, pathology, microbiology questions. So basically, it's just a general MCQ exams like you give for the council exam. But yes, it's not tough, I would say. If you read enough, then yes, you can always get through it. It's basically like council exam itself. But if you ask me, in comparison to the PG examinations, how is it? It's easier. Our PG exam is more tough than the Plab exam. And so MCQs. So Plab 2 question is, you'll be given a scenario, which is why I was referring to your short case. So you have a 45-year-old man who presented to you with complaints of chest pain, shortness of breath, and is having a temperature of 39.5 degrees Celsius. When you ask for the questions, he's saying that he's also got cough. Speak with the patient, take a good history, do the relevant clinical examination, and manage the patient. So this is a scenario. This is a basic example of a scenario. Now what you do is, this is where it comes like. So you have got a brief summary of what are the things. So you examine the patient, you take a good history, go all those chief complaints. If you want, if those who are preparing for Plab, then I can do a separate things on how to approach to a Plab station, or how to approach to a patient in the UK as well. You can always contact me on that as well. I can do a full session if you have a good amount of number. But basically, as I said, you'll be given a summary of a patient. You need to go and speak to the patient. So basically, what are your differential diagnosis on this scenario? I would say he must be having some chest infection. But if he's a smoker, you need to figure it out whether it's a lower tract infection or upper respiratory tract infection, isn't it? So yes, if you for instance, let's say it's pneumonia. So pneumonia, you will not be asked question by your examiner at all. So you need to speak with the patient face to face. So I suspect that you have got a condition called pneumonia, which is basically an infection of your chest. So in this way, you'll have to explain what is the diagnosis. Well, how are you going to manage it in terms of investigations? Like you do a chest X-ray, I'll give you some antibiotics, and we might have to do some bloods as well to check whether the infection is creeping up or not, things like this. Yeah, this is how you'll be asked. This is a basic patient scenario. Now, in other cases, you'll be asked to take bloods from the patient. How do you do bloods? How do you do cannulation? And the most important thing, sorry, I like to mention on this itself, all those interns or even medical student go and practice cannulation. I struggled because I had not done that before. I used to not do that before at all. But here I struggled firstly to put cannulas in patients. The vein used to just blow up. But I would suggest if you are preparing for PLAB, but also not only for PLAB, it's good for your it's good for your practical skills as well, isn't it? So go and put a cannula in, because this, if you're preparing for PLAB, this might be an station, so you'll have to learn how to put a cannula in. And if you're preparing for PLAB, speak to the patients that you would do on a PLAB exam while you are treating your patient back home, and slowly you'll start building it up, because it's just the language, it's different, the diseases are the same, management is slightly different because it depends from country to country. But yes, this is how the exam is conducted, basically. I hope that answers your question.
Hastai. Now we have a very long question, so that if you can indulge me for a moment.
Yeah, sure, why not?
Everyone keeps saying, do palpable or Dr. Khalid's 1700 question, but no one tells us how to use it.
Mm-hmm.
I think reading and solving question won't work for everyone. At least I can speak for myself. Could you please explain what you did in your dedicated hours and what you want us to do and not do in those hours? And is there any video source or platform that are used by that we can use? And please enlighten us about PLAB too. So this is the question. Do I need to repeat it again?
No, I think I got the gist. But for PLAB 2, but I'll go through it again. For PLAB 1, yes, I prepared. What I did is I went through questions and explanation. This is how it is, to be honest. For me as well, I struggled because I had a habit of putting the book in front of me and studying, rather than going to the computer and looking at the questions and explanation. I found it difficult as well, and now currently as well, I find it difficult quite sometimes when I'm preparing for other exams. So what I did for PLAB was, I went through the questions, I went through system by system, and wrote through the explanation. I wrote the explanation, went through it, highlighted the key points. So like in the previous, when I was talking previously, whether you heard or not, like chest pain and fever, shortness of breath, and a 45-year-old man also has productive cough. So yeah, what is the diagnosis? It's a pneumonia. So key point is pneumonia. Then I would just write a pneumonia. Key point is this. But what are the treatment options as well? So I used to basically prepare that whole case scenario itself. Anatomy, you'll have to. Anatomy, pathology, and pharmacology is something you'll have to study. There are always references book that you can refer to, like Oxford Handbook of Clinical Medicine, Oxford Handbook of Foundation Medicine, Oxford Handbook of Surgery. You can always, if you're not understanding that topic very well, you can always go back and study. There's no harm on studying that topic as well, which is why I said it totally depends upon person to person when you're preparing PLAB 1. I said within 1.5 months, they only did question, knew the answer of that question. Okay, if that question comes up, this is the answer, dang. But at the same time, they passed. That's what important. They didn't score quite high. That was their aim, just to pass the exam. So yes, if you're doing that, then I would suggest to print Khalid 1700, print it, make a book of it, go through it, highlight the points. I guess you have a habit of highlighting things, studying, going through. Give around 3 months of time to prepare yourself, and then go through things. Even when you're doing PLABable, make notes. So the topic that you're studying, make notes. Suppose if you're studying lymph nodes of abdomen, then what are the other lymph nodes as well? Because that will help you answer the other question as well if you know that. So just make note of it. I made a note. I had 3 copies of note for PLABable itself, which I gave it to my friends. I made a good note of the topic that I was studying. So you can do that, but unfortunately, there's no specific book or video, because at last this is a money game as well, if I'm being really honest, because if they give you all the materials or all the books, then nobody's going to subscribe their thing, isn't it? But at the same time, they help people as well, and we can't complain as well, because they are the one who help us to get through that exams. So I would suggest make notes. That will really help you, because you don't have to open the computer again and then go through the questions again and again. You can just go through your notes, and you will be pretty confident enough on ticking those, answering those MCQs. But unfortunately, this is just MCQ exams. So I think that'll answer. I hope that has answered your question. If not, you can ask a follow-up questions to this as well. Now, PLAB 2, I had already explained earlier, but let me go briefly. As I said, you will be given a quick summary as you'll be asked, as you are generally asked, summarize your case by your professor during your exams, or your formative exams. They will give it to you, and you'll have to, from the summary itself, you'll have to do history. You'll have to take a good history, and let me tell you, the PLAB 2 exam. I forgot to mention it previously. You'll only have 8 minutes. So within 8 minutes, you'll have to take a good history, do a quick examination, come to a diagnosis, and explain it to the patient, manage the patient. So you have 8 minutes. That's all. Within 8 minutes, you'll have to do everything: history, examination, and there will not be some examiners. There will be some stations like OSCE stations where you will be asked questions by your examiner, but there will be a person standing right in front of you who will be an actor. The person is so well in acting, trust me, they will mimic the same as your patient that you face in a day-to-day life. They will be given a typical history. So you have to pretend that you have a severe abdominal pain. In the history, you will have to say that this epigastric pain or periumbilical pain is going to right iliac fossa. You are having temperatures. You have vomited. If it's female, I have not, and you need to be very precise about asking their history, their personal history. And then you'll have to come to a differential diagnosis, and then you'll have to explain to the patient. And once you explain to the patient, then they'll stay calm, and then they'll listen to you. So this is how they are taught, how they are prepared in terms of acting. Okay, so this is basically a scenario for a PLAB 2, ectopic pregnancy or appendicitis. So yes, you will be having these things. So I hope this answers your question. If not, for PLAB 1, if you want other things, then yes, you can always ask me again.
Astai, there are a lot of questions coming in, piling up. So I request the participants to be patient. We will address the question to our DAI as much as we can, keeping the time constraint in our mind. Also, there seems to be a recurring question many participants are asking, which is about the expenses. How much does the resident earn? What is the expenses? What is the travel cost? What is the food and accommodation cost? And is it expensive living in England? Could you please answer it?
So let's start from the journey. As I was mentioning previously itself, yes, there are lots of places where you'll have to pay money, and it's quite difficult asking your parents again and again. So if you are going to India, it really depends upon how you live your life as well, isn't it? Like if you're happy in staying in a single, like a small square box as well, which it is literally is sometime here in the UK, you will not have to pay much. So traveling, it's ticketing is based on the airlines itself. Now, after you've landed in the UK, you'll have to look for accommodation. So for accommodation, there are lots of places. You just have to keep on searching. There are spare room, Airbnb, right to move. There are a lot of places where you can find cheap places. London, everyone knows, is expensive. I am currently living in London, but my earnings is sufficient enough for me. Uh, Basically, I'm living I'm living a satisfied lifestyle in terms of if you're asking if I'm on enough or not to live in London itself. I'm more than happy. Of course, I would want if I want I can live more, but it totally depends if you want to do savings or not. It's totally depends upon person to person. So, but in Manchester it's a bit cheap. Let's talk about your Plaque 2 exam. So when you go there, you can make a group and you can book a place and you can pay like usually it is 130 to 160 pounds per week for a single room when you come for a Clab exam. But it can come to, if you look for places, if you are keep on looking, you might find it up to 100 pounds as well. But at the same time, as I said, it totally depends upon either you're coming alone. Traveling is quite cheap here because you have good access to they have good railway system, so traveling is a bit cheap. If you book in advance, like if you book 2 or 3 weeks back, 3 weeks in advance, then it's really really cheap. But if you book tomorrow, next day, if you want to go somewhere, and if you book today, if you want to go tomorrow, then obviously it will be expensive. Exam fee, as I've already mentioned, the academic fee. So this is the question that I get asked a lot of times. Academic fee varies upon academy. So I don't suggest any academy is good or bad. It totally depends upon you. That's what I've seen, because I have colleagues who have taken other courses like Aspire. I personally took Samson. I've seen Common Station and lots of other stations as well. But everyone has passed. So it totally depends upon you. How you go to the exam, how you have taken this Clab exam it totally depends upon you actually. So once you finish your Clab, if you can directly go return back home as well, and or you can stay here and start applying for jobs. So if you have money, stay here and then apply for jobs. And as you stay, your rent will go up every day per week. So obviously that is an expense which you can cut off. But in general, I think from landing here to completing a Clab 2 exams, including all the academy, I think from my personal experience, I'm talking, it might be different for other people's. I think 2,000, I think 3,000 pounds should be enough. More than enough, to be honest. That's excluding all the ticketing and other things. But rent and other things, food is cheap. And at the same time, you can save food by cooking yourself as well. So yeah, there are a lot of other options as well. But if you want to come order McDonald's, order Subway, or Domino's, or there are lots of food options. So yes, if you want to do that, then again, yeah, your expenses is high. So it totally depends upon you. But on average, keep it 2,500. But yeah, 3,000 should be more than enough. This is from my personal experience that I'm sharing you. I hope that answers your question with regards to expenses. Exam fees are what it is. You cannot dodge that. There are no discount on that. Okay, you'll have to pay it. I'm sorry. Yeah, that's it. That is what it is.
Thank you, Dai. As you all know, we do have a time constraint. So I think we'll take last 1 or 2 questions and end this round. If you have any further question and want to follow up any other question, you can directly ask our speaker Dai, Ashish Dai, through his mail, which is so sportingly shared with us in his slide, and we'll drop it in the chat box as well. I'm sure he'll be pleased to answer it in his own time. Right? So I'll take. So we have a penultimate question, which is very relevant to our current political scenario. How will Brexit affect us IMG doctors? Can we work in other parts of Europe? So this is the question. Can you please answer?
No effects at all. There is no effect at all for you guys. Don't worry. You do not have to worry. Finish your Clab, Come, do it. There's nothing. There's going to be no constraints. There's going to be no relation at all with you guys from Asian. Don't worry at all. Do not think that it's Brexit. They're going nothing. It's unfortunately speaking, it's a benefit. It's a I don't know if it's a benefit. Yes, because now the European country graduate will also have to give exams like us. So previously they could just come in and get registered with GMC. Now they'll have to compete like us. So don't worry. Finish your Clab exams or membership exams, other membership exams. There's not going to be any effect on you. Forget this political thing. Focus. Okay? Don't worry. So not worry at all.
And then the last question that we have is it true that some subjects can be completed in less time and others take long time for completion? Like MD-GP can be completed in 3 years and surgery takes...
Sorry, I didn't get that.
Okay, I'll repeat it. Is it true that some subjects can be completed in less time and others can take longer time for completion? Like MD-GP can be completed in 3 years and surgery takes...
I think I got that question. Okay. Yes, actually yes. So the thing is, yes, GP, they're planning to increase in up to 5 years GP as well with some interest. But yes, GP is only 3 years. It's because GP is an integral part of this health system here, to be honest. GP have to see patient on a daily basis, and they will have to send patients to respective teams. But for surgery, you slowly develop your skills here. This is the training system here, unfortunately. It's not like in Nepal, a very rigorous training. You are expected to learn certain things because you are going to become a surgeon. Like in ST1 and ST2, you learn how to manage your ward, and at the same time get some surgical experience and other things. But as you move on to ST3, you will have slowly gained surgical experience, slowly. So they are training you to become a consultant under which there will be a lot of patients. So yes, GP takes 3 years, which there's a buzz around saying that they might increase it up to 5 years, but nothing concrete. There's no evidence of that at the moment from Royal College of General Practice. But yes, if you speak about emergency medicine, it is 6 years, I think. All surgical specialties is 8 years. Medicine is 8 years, apart from GP. So yes, radiology is 5 years. So if you want to be, radiology is 5 years. So yes, the other thing is, but this is what it is here. So basically they've done lots of research here in order to make a person competent enough to do everything. So as a consultant, you will be doing all on your own. You'll be taking referrals, you'll be operating, you'll be seeing patient in clinic. So everything comes onto your head. It's not like in Nepal, like you have junior and senior consultant where the professor is there and there's a no. That has equal response. The consultant has equal responsibility of the patient. So this might be the reason why the training program is very lengthy here. That is what I've experienced speaking anecdotally. So from experience, pardon me. But yes, it is lengthy. Unfortunately, I can't help with that. I also asked the same question when I first joined. Why 8 years? 5 years would have been enough, but they have their own reasons for that.
Now we have come to the end of the...
It's okay.
We have come to the end of the question and answer session. Thank you, Dai, for answering all these questions. I hope most of our participants' doubts, queries have been cleared. Again, I'd like to repeat, if you have any further question, you can ask him directly through his email address. It's in the slide and chat box as well. Now we have come to the end of this program, or Road to Plab. I'd like to thank our speaker, Ashish Basnet, for taking time out of his hectic schedule and giving this wonderful talk. I'd also like to thank my teammates behind all of this, without whom this program will not be running so swiftly as it is. So, Chadidi, Karthik, Banu, and our president Almond Dai. And also, Dai, do you have any concluding remark at the end of this session? A very short, sweet, brief concluding remark. Would you like to say anything?
Yes, thank you for giving me an opportunity. Yeah, sorry. Yeah, I was saying. So yes, thank you for giving me an opportunity to speak, to share my experience, and to guide my fellow juniors about Clab. I hope I had this as well. Although I had my friends who really helped me, but yes, at the same time, with regards to other things as well, because they were also. They were also in the dark, like when things came to certain things. But yes, now we have lots of people who are helping around, who I know can help you guys around as well, like in terms of guiding you through Clab and what are the things that you need to do. There's a page in the Facebook Clab Help Nepal, which is where we have lots of people who are working here in the UK who can guide you as well, who can help you as well. If there is any questions, you can always ask on that group itself. You will definitely get a response on that. And if you are very shy and if you do not want and like anyone to know that I'm doing Clab and you want to ask me personally, I'm contactable through any means. If you want to contact me through WhatsApp, I will send Onmol or Janice my WhatsApp number, and you can directly contact him as well. I cannot share my number here from the YouTube, I guess, which is why, for various reasons. Sorry, but yes. Thank you so much, guys.
And a reminder to all of you, we'll be having more sessions like this in the upcoming days. We have session on USMLE and the prospect of doing post-graduation in USA and also in Nepal as well. The journey, the process, all those nitty-gritty details. We hope to see you all there as well. So keep an eye on us through our social media account, and we'll be disseminating the information through that as well. Thank you all for your participation and being so patient. Thank you, Dai, for your talk. Take care, everyone, and take care of your dearest ones. Thank you. Good night to all of you. Have a great one. Bye-bye.